All right, I wasn't really sure where to start with these videos, but I thought I would just start at the beginning and talk about what the biopsy process is like. I know that is something that I was scared of when I first got diagnosed, and I didn't know what it was going to be like or what to expect. And so I thought I'd share a little bit about what that process is like, and then I will share my story and what my biopsy was like towards the end of it. I did have some complications with my biopsy, and that is super rare, but I think it can be beneficial to hear and understand those stories so that you cannot be so scared of them. All right, so biopsies. What is a biopsy? A biopsy is where they basically can stick a needle into a tumor to grab out some of the cells so that they can look at it under a microscope. That is how they determine what type of cancer that you have. They oftentimes won't biopsy earlier stage tumors if it hasn't spread anywhere else, and they plan to do surgery anyways. In those cases, they'll typically just take the tumor out and then they'll send it off to pathology after it comes out. There's no need to go through a biopsy in those scenarios, but always just defer to your oncologist. Whatever plan they've picked for you is going to be best for your specific scenario. There's also a few cases that they don't biopsy. HLRCC is typically one that they try to avoid biopsying. If they find a lesion and you're a candidate for surgery, they'll typically just take those out instead of biopsying them. HLRCC is hereditary, so you typically have a family history of kidney cancer in that case, and they can do some gene testing to find out if you are likely to have HLRCC. So one of the things I know I was most concerned about when I had a biopsy is I heard about seeding, and I heard that people didn't do biopsies because of seeding and it can cause the cancer to spread. I think that's important to talk about because I was very fearful of it, and I thought like, okay, if we do this biopsy, is it all of a sudden going to grow in my lungs? I didn't understand what seeding was or what really the risks were there. It was something I had heard and was scared of, and I just want to say that that's not something that you need to worry about. If your oncologist has sent you for a biopsy, then they think the benefits outweigh the risks and you should be going for that biopsy. There are a few case reports in history of seeding, and that's typically with older methods that are no longer used for biopsies. Also, in the few cases that there was seeding in the past, it didn't spread somewhere else, random place in your body. It grew along the track from where the biopsy was done at. So like you can see the needle go in and out, that is where the cancer would grow and spread. But like I said, that is extremely, extremely rare now, especially with new practices. And so it's not something that you need to be worried about. I know I wish I would have known more about that. I spent a lot of time worrying about seeding before I had my biopsy. But again, I was very cancer naive. So the process for a biopsy, they will send you in and it will likely be an outpatient procedure, meaning you do not have to have a hospital stay for it. You'll go in, you'll fill out a few papers to sign and give permission for the biopsy. And then they will put you under a type of sedation. It's not general anesthesia typically, so they don't completely knock you out. They want you to be conscious so that you can respond to questions as well as like breathing. So for example, during mine, I had to breathe in a certain way in order for them to go in and everything kind of be holding still while they went in and did the biopsy. So they want to make sure that you're conscious for that. But the drugs they give you will ease your anxiety. So I am a very anxious person and I got very worried and I was scared the whole time, and the drugs help. So you'll be fine. Also, my kidney biopsy was a walk in the park. I was super scared that it was going to hurt. It didn't hurt at all. I didn't feel a thing. So once they give you the sedation, I don't know if that's the proper term, but once they give that to you, you're nice and relaxed. I rolled over to my stomach and they did the biopsy through my back. They give you some local anesthetics as well. It's not the right word. I don't know the right proper terminology for any of this stuff. But they treat the area locally so that you can't feel anything either. And then they stick the needle in, grab the tumor cells, whoop, pull it back out. And then they usually have pathology in the room there so that they can take a look and make sure that they got a proper sample. And if they do, they say, cool, all good, and you're all set to go recover. And so typically if you only have a kidney biopsy, that's all they'll do. They'll put a little Band-Aid over it, and then they'll send you to a recovery room where you will recover. You'll typically lay flat for a couple hours. They don't want you moving. so that your body can kind of heal up and heal any bleeding or anything that was happening. And then they will send you on your way after that. Basically, they just monitor you to make sure that there's not any bleeding and that you're going to be okay, and then they'll send you home. So super easy process. My kidney biopsy was a walk in the park. I was so nervous about it, and I did not need to be. So I hope that helps people who might be going for a biopsy. It's a pretty easy process. You will get the results typically anywhere, I think 3 days is pretty fast, but I think it's like between 3 and 7 days you'll get the results back from your biopsy typically. It takes a little while to get the results, but then they'll be able to tell you what type of cancer you have and specifically the subtype, which is the most important part. All right, so that's how the process for a biopsy goes in general. I also said that I would share my story about what it was like for me. So my kidney biopsy was a walk in the park. It was super easy. My liver biopsy, they did a biopsy of my liver, and the liver is much more vascular, so there's a higher risk of bleeding. I knew that going into that, and it was something I was super worried about, but it rarely happens. It's a really rare complication, but it can happen. I did end up having a bleed during my liver biopsy, and it happened to me because I have a bleeding disorder. So we did find out that I had a bleeding disorder. It's not something I knew at the time. It's something I found out afterwards. And I wanted to share this story because I know I was absolutely petrified of this happening. And I thought, okay, if I get an internal bleed, I'm going to bleed to death and die. And I was scared. And so I know before I went for my biopsy, I was so scared about that. And I think it helps to share my story to help other people understand what it looks like when there is a complication or something does go wrong. So I had my kidney biopsy, and then we rolled me from my stomach onto my back so that we could get to the liver lesion that we were going to biopsy. Same thing, I still had the sedation, and then went in. I think it took 2 approaches for the liver. I kind of felt the second one, so I definitely felt it more than I felt the kidney, but it wasn't super painful or anything like that. And then it was over. They got all the samples that they needed. So before they send you on your way and to the recovery room, they run the ultrasound back over. The ultrasound is what they use to guide the needle. So basically they'll be running the ultrasound on you, and they'll be looking up at the screen to see where the needle is going. And so they do that afterwards. They run the ultrasound back over that area to make sure that there wasn't any bleeding. And there wasn't when we first looked for mine. So the doctors left the room, and then I started to feel really not well at all. I just didn't feel good. I was telling the nurses that I don't feel good, and they're kind of like, yeah, it's probably just the medication. And it's like, yeah, no, I really don't feel good. And I started to get that feeling like I was going to pass out. I started to get really hot. My hands were clammy. I was like, I'm so hot. Can you please take these socks off of me? And I was like, I just don't feel good. I don't feel good. And then I hit that feeling where I was, okay, I'm about to pass out. And so I was like, can you please get the doctor? I don't feel good. And so they went and got the doctor, and then the doctor came back and was like, I don't know why I'm feeling this way. But I also was like, am I supposed to be having pain in my shoulder? Is that normal? And the minute I said that, the doctor said, get the ultrasound right back on her. So what I was having was referred pain. Basically, I was having a bleed that came from the area that was biopsied in my liver. But that pain was being referred to my shoulder. And so I was feeling that pain in my right shoulder. And so when they did the ultrasound, they did see that I was bleeding, and it caused a bunch of panic. This part's kind of a blur for me a little bit, but I was not feeling well. I started to get the dark tunnel vision. I knew I was going to pass out. All of a sudden my blood pressure started tanking. I saw the nurses kind of panicking, like her blood pressure's crashing. And then another nurse was on the phone saying, okay, should we call her husband? And so they called my husband. And I just remember focusing on the corner of my eye, I did not feel good. And the fellow had taken my legs and lifted them up to try to get the blood to flow to my head. But I just remember looking up at the nurse. There was a phone on the wall in the corner. And I just remember looking up as she was calling my husband and was like, things didn't go quite as planned. I've had a little issue during the biopsy, and you should probably come in. And so my husband was waiting out in the parking lot because of COVID. And so he was able to come in at that point, and he was going to go up to the room that I was going to be taken in after that. So I just remember I was so scared in that moment. I felt like I was passing out. I remember being scared because like this is what I had feared, and I had thought that you have a bleed and you're a goner. And so I remember the fellow and the doctors around me just said, hey, stay with me, because I was like, I don't feel good. It was just the feeling of passing out, but it was scary. And so I remember them trying to do everything. And so then they rushed me into a emergency CT scan. And during that time, I started to feel some pain in my lower abdomen. And I remember telling the doctor, I said, I'm starting to get some pain, like in my pelvis area. It kind of feels like the pain that I get from cramps. So they did a abdomen pelvis CT, and we saw that I did have a bleed. It was a moderate bleed, not a major bleed. Pain that I was feeling in my lower abdomen was because some of the blood was draining down in that area too. So I also had a lot of pain, I couldn't really move very well. It hurt to take a deep breath. It hurt pretty bad to take a deep breath. And that's because I had a lot of blood in that area and it was irritating my diaphragm. So it made it difficult to take large breaths. But once they saw that bleed, they saw it was moderate, they decided, okay, we're just gonna keep an eye on it. So they sent me back to the recovery room. It's the same room that everybody goes to after a biopsy, and you wait there for a couple hours. So I was laying flat, and then I had to go to the restroom, and so they told me to get up. I think that I probably got up earlier than I was supposed to, because I was only in there for like an hour, and then I had stood up. It shouldn't have happened in that time frame. But I went to go stand up, and it hurt bad to move. Like I said, I had a lot of blood in there. It was causing some pain. And so standing up, I started to get the tunnel vision again, and so I was gonna pass out. They laid me back down. Again, my blood pressure crashed. A whole bunch of commotion from the nurses. And then we decided after that they were going to admit me, which took a really long time to get admitted. It was also peak COVID cases, and so there was not a lot of rooms or beds. We eventually got me admitted to Huntsman Cancer Institute. And they were incredible and amazing, and I'm so grateful for that. So I was laying in that bed for a while recovering. They gave me some fluids to raise my blood pressure, which helped. And then the fellow and the attending, the fellow is the one that did the procedure, and the attending came back up to the recovery room, and they checked in on me several times, which I was so grateful for. And I could tell that they were genuinely concerned about me. I think about that often, in that moment often, and as I share some of these stories, I'm probably gonna get teary-eyed. They had a very big impact on me. It was a very scary moment in my life, and they were there for me. And I knew that it was not standard practice for them. And so it was just one of those moments that I could tell that they genuinely cared. And I went a long time before I got diagnosed feeling like I was dismissed by a lot of doctors. So it was kind of a pivotal moment for me where I felt like I was finally being looked after and really cared about. I remember at one point, so oncocytomas look a very specific way, and on scans, they have what's called a central scar. And my radiologist had looked at these scans, and that's why he thought that it could have been an oncocytoma. And he'd actually written textbooks describing the imaging of an oncocytoma before. And so the fellow was in the room, and my attending was in there, and they were just checking on me, seeing how I was doing. And as I was talking to them, I got to ask them all kinds of questions, which was awesome. Like, a lot of people don't get that opportunity. Most people don't get a chance to talk to their radiologist. And so I'm a very inquisitive person. So I asked all kinds of questions about why they thought the imaging looked a certain way. And he described kind of how he saw it, and he described how oncocytomas look, and just gave me a lot of information. And they just chatted with us. They answered any medical questions I had to, but they also just talked with my husband and I, just like we were just normal people. And they had a genuine concern for me. And they were amazing. They stayed late in the night. I think I finally got admitted around like 8 or 9, and they both were still there. So I got admitted, I stayed overnight. The next day, so they don't normally have like a service for interventional radiology to stop by and check on patients, because it's usually like oncology or surgery or somebody like that that's going in and doing rounds on these patients. But the attending came back. I remember as they were wheeling me over to Huntsman, there's like a little hallway that takes you in between the University of Utah and Huntsman Cancer Institute. And I remember as they were wheeling me across there, the doctor let me know that he had to take his daughter to school the next morning, but then he was going to stop by and check in on me. And he did. He stopped by the next morning, and he made sure to check on me before they discharged me. And I wasn't normally part of a service that he had. Like, he doesn't normally check in and do rounds on patients. And there was already a doctor that had done rounds for me. He was just stopping by to make sure that I was okay. And that meant a lot to me. And it just really showed me very early on how much these doctors truly do care. And it just meant a lot. It was a small gesture that he did, but it meant the world to me. And I wanted to share the story and kind of what happened to me through that process. It was very scary at the time, and it was painful, I won't lie. It was painful, but I didn't take any pain medications, and that's part of it. They gave me clearance to take pain medications, but I didn't want to, because I wanted to be able to feel. I could feel when the bleed was getting worse because the pain would get worse, and so I didn't want to take pain medications, and so I avoided it. But I probably could have prevented myself a lot of pain if I had just taken them. I just want to share this story because I know I was really scared when I was going through the biopsy process, and I got scared of what could go wrong. Like, what happens if there's a bleed is at the end. And so I wish I would have had a story like mine to have heard, to know that everything will be okay. So I was in the hospital just overnight. They watched me, and then I finally got to the point where I could get up and go to the restroom on my own. I was still in pain, and it still hurt to breathe, but I got up and moved around a lot, and that really helped my body heal. And after, I think, 5 or 6 days, I was walking like a mile or two again, and just had little band-aids over those spots, had a little bit of bruising, but nothing major. It did take like 3 weeks, 2 or 3 weeks, I think, for my body to clear all of the blood that was kind of hanging out in my body afterwards, and for my hemoglobin to come back up. But it came back up, everything normalized, and my body fixed itself. We did end up giving me some fluids that raised my blood pressure, but the rest kind of fixed itself on its own. There are people who have bleeds that do need interventions after biopsies occasionally. I was not one of those cases, but I just wanted to share that story because I think if I had seen somebody go through what I went through before I went through it, I would have been less fearful of it. And so I wanted to share my story in case it can help anybody else. But this was super long. Again, I don't know if I will figure out how to make these videos shorter or be more succinct. Let me know if these videos are too long in the comments. Like I said, I'm just getting started with this. I hope this is helpful. If it's not, I'm open to feedback. Tell me what's helpful. What do you want to know? Do you want long videos, short videos, medium videos? I don't know. Just tell me what you want and I'll help make videos the best I can. Hope this is helpful. I hope that helps to understand what the biopsy process looks like for kidney cancer and what it looks like to have a liver biopsy and complication. But that's it.